Hi everybody, welcome to the Health How-To channel where we talk about some great life hacks and easy tips to achieve better health. In this video, we're talking about how to reduce chronic pain naturally, other than deep breathing or meditation. But first, please subscribe, like, and share your best tips that you have found to be super helpful for decreasing long-term pain in the comment section below. If you have someone in your life who you really want to support, please share this video with them too. Also, this video is purely for information purposes and does not in any way replace any advice given by your own healthcare providers. If the exercises or information suggested aggravate your condition, please stop and ask your healthcare provider for further direction. So what is chronic pain? In general, chronic pain lasts more than 3 months. It could be anywhere in the body in one or multiple spots. Chronic pain can happen even after the injury has healed or with a negative diagnostic test like X-ray, ultrasound, or MRI. Chronic pain can happen when your brain or body has become more sensitive to pain after an injury or disease like bone break, herniated disc, whiplash, or cancer. And finally, chronic pain can come and go, such as pain from arthritis, fibromyalgia, neck, and back pain. According to the Cleveland Clinic, approximately 25% of adult Americans experience chronic pain. What does this pain feel like? Chronic pain can be pinpoint or widespread. It can change from sharp and stabbing to achy and unrelenting. It can travel from one body part to another. It can vary with the weather, your mood, time of day, your stress level, and how tired you are. What's concerning about chronic pain is that it can also lead to long-term feelings of irritability, anxiety, depression, difficulty sleeping, mental fog, chronic fatigue, and a sense of hopelessness and isolation. How is chronic pain treated? Sometimes when a person has had pain for years, it's also an issue with the pain sensing system itself. We generally think of pain as a sign that we have injured something or that something wrong is happening to our bodies. If we accidentally cut ourselves with a knife, it will obviously hurt. But our brain can also produce or amplify the sensation of pain too. Our brains can produce a wide range of physical experiences, like when we think of something scary and we physically shiver, or if we think about eating cockroaches and our stomachs churn in disgust. So imagine that we've had pain for months from a cancerous tumor and it gets cut out. Why is it possible to still feel pain years after the tumor is gone? Why do amputees still feel their leg if it gets cut off? Our brains can recall the feeling of pain when we get anxious about our health. It doesn't mean that there's no injury or it's all in our imagination. Instead, we can imagine our brains as a sort of speaker amplifier. We have the ability to turn up the volume on our pain experience or turn down the level of our chronic pain, but it takes practice, a lot of practice, to retrain our brain and the way we think. How does our brain turn down the volume of pain? Well, the brain itself can produce opioids, similar to painkillers, to decrease pain naturally. Have you ever had the experience of suffering from a lot of pain, going to the doctor's office, and as you are sitting on the table, you realize that your pain is gone? Or how about having back pain for months, go on vacation, and somehow your pain is magically gone? Well, that's your brain controlling what you feel. Sometimes it helps to think of our brains like our heart. We know that when our heart is racing, we need to try to slow our heart rate down with deep breathing and calming thoughts. So let's try to slow our brains down and make different, stronger, positive connections to manage pain. This video will share some general techniques to help turn down the volume of your chronic pain, no matter what the cause. Tip number 1, prioritize your sleep. It's a vicious cycle. Pain doesn't let you sleep, and then you're tired and cranky and unable to deal with your pain, which leads to more pain, more sleepless nights, and the less you sleep, the more fatigued you feel. Long-term sleep deprivation can also be linked to heart disease, high blood pressure, persistent low energy, poor memory and concentration, slow response time, mood disorders, weight gain, and headaches. There's a reason why sleep deprivation is often considered to be a form of abusive torture. I think good quality sleep is the most influential factor when it comes to managing chronic pain. Just like food and water, sleep is a crucial necessity for the body and brain to function at its best. Check out some of our other videos for tips on how to get better sleep. Tip number 2, progressive exercise. Again, chronic pain causes a cycle that is so hard to break out of. You try to exercise or even do basic activities of daily living, which causes pain and inflammation, so you stop, which then causes stiffness and pain. It's like you can't win. It's really a fine line between too much activity and too little. What makes it harder is that this fine line depends on a number of factors: your energy level, your current fitness level, your mood, your stress level, and your workload, to name a few examples. So let's get into how to exercise progressively to break the pain cycle. Let's start with a goal in mind. What kind of physical activity do you really want to get back to? Is it playing soccer with the kids? Is it a hike in the forest? Hockey with your friends? Dancing for hours? Set a time frame. When do you want to accomplish this? 6 months? 9 months? Maybe a year? The longer you've had pain, the longer it will likely take to make the necessary incremental changes. Hold this goal in your head when you're struggling to push through the pain. Watch inspirational videos of athletes who came back after serious injuries. Paralympics. Watch YouTube videos of an 18-year-old Terry Fox running across Canada with one prosthetic leg for cancer. Or 80-year-olds completing the Ironman. Nobody is suggesting that you need to run across the country, but it can help inspire you to believe that you don't need to be confined to your bed for the rest of your life. You may never be completely pain-free. Don't waste your life waiting for that to happen. Stage 1, start stretching. If you're a beginner, start with 5 minutes of gentle, whole body stretching movements in a pain-free range. Once you master 2 weeks of daily 5-minute movements, then you can increase it to 2 5-minute sessions. Try that for 2 weeks. Next up, 3 sessions of 5-minute whole body stretching. The idea is to do small amounts of low intensity pain exercises throughout the day to let your brain know that it's okay to move and stop equating exercise with pain. Once you can do 4 sessions of 5-minute stretches comfortably without triggering pain, you're ready for stage 2. Stage 2, add a walk. Walk outside and get some health-boosting vitamin D from natural sunlight. Studies have shown that vitamin D can lower our perception of pain. And rather than taking supplements, it's much more beneficial to get vitamin D the natural way. It is recommended, though, to walk before 10 a.m. and after 4 p.m. when UV rays tend to be lower, depending on the weather and where you live. Start with a 10-minute leisurely walk for 2 weeks before increasing it to 15 minutes for another 2 to 3 weeks. Finally, try to aim for at least 20 minutes a day. Stage 3, add some strength training. Every 3 days, add 5 minutes of whole body strength training. Try 10 repetitions of each of these 10 exercises. There are always ways to modify these according to your strength, comfort, and area of pain. Number 1, squats. Number 2, push-ups. Number 3, overhead press. Number 4, plank. Number 5, lunge. Number 6, step-ups. Number 7, Superman. Number 8, sit-ups. Number 9, jumping jacks. And number 10, high knees. A few tips about progressive exercise. Try to complete 2 weeks of the same exercise before moving on. You want to make sure that your brain and body gets used to the movements. If you need a bit longer, go ahead and do it for 3 to 6 weeks before increasing your repetitions. We want small, gentle increments so that we don't trigger a pain reaction. Depending on your actual condition, you should consult further with your physiotherapist to decide if an exercise is good for your condition. For example, if you have severe knee arthritis, you are probably not going to be doing jumping exercises. Stage 4, goal activity. Now that you have a certain level of fitness under your belt, start to expand your exercise to that goal you're trying to achieve. Choose something you really enjoy. For example, tennis, golf, biking, volleyball, Zumba, or swimming. These activities take a little more endurance and require a little bit more cardiovascular fitness. But the point is that you enjoy doing them and your brain equates that with socializing, fun, and joy instead of pain. Again, try to make it a regular activity, perhaps once a week to start. Tip number 3, reframe your thoughts. Obsessing on negative thoughts can really amplify your pain. It can send you down a spiral and lead you to obsess about the worst case scenario. What if the pain never goes away or gets worse? Or I'm stuck in a wheelchair or never be able to work or be normal again? The more we think like that, the more anxious and depressed we get, and the worse the pain you experience gets. Don't let yourself dwell on your greatest fears. When it comes to pain, negative thinking won't help you get better. Try your best to remember positive things that have happened and think about things you're grateful for. This step is really difficult, but the more we practice switching from negative thoughts about pain, the easier it gets for the brain to rewire itself to make positive connections. Tip number 4, join a support group. These days, joining support groups is so easy. You don't need to travel far. In fact, you don't even need to get off the couch. Just use your computer or phone to connect to one of the thousands of online support groups who really understand what you're going through. They can provide that motivation or allow you to complain when the pain is unrelenting, or when you feel alone, or when you don't want to bother anybody with your needs. Chronic pain can feel very isolating, and it's important to know that there are so many others who are in the same boat. Perhaps they can share ways to cope that may be useful to you. If you have some great health tips for chronic pain relief, I'd really appreciate it if you could share them down below in the comment section so that we can all benefit in our personal journey to better health. Please subscribe, like, and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Thanks for watching, and I'll see you in the next video.